It can come as a surprise when someone opens up to you, even in passing remarks. It's crucial to understand the distinctions between confidentiality and mandatory reporting requirements. If you anticipate that someone, particularly a minor, is about to disclose something, consider interrupting them to clarify whether you might be obligated to report the information. Responding to a disclosure involves several key aspects. Firstly, prioritize listening. Listen with the intention to understand, not just to formulate a response. Approach the conversation with compassion and curiosity, allowing the individual to guide the pace of the disclosure. Refrain from seeking specific or intrusive details unless necessary for determining reporting obligations. Next, demonstrate belief in their story. Understand that their narrative may initially seem unclear, perhaps due to memory lapses or confusion about the sequence of events. Focus on validating their fears and concerns rather than scrutinizing every detail. Thirdly, validate their emotions. Recognize that they may still be processing what occurred and may even be in denial about its severity. It can be profoundly therapeutic for victims to feel validated and believed. Acknowledge their feelings, reassure them of their courage, and affirm that they are taking the right steps. Avoid making promises about the future or downplaying their experiences. Maintain a calm tone of voice, even if you are experiencing strong emotions. Offer support in any way you can, whether by connecting them with resources or professionals specializing in trauma care. Describe the next steps to the best of your ability while refraining from sharing personal experiences of violence or disparaging the perpetrator. Lastly, respect their autonomy. Inquire about their needs and preferences, allowing them to make decisions about their next steps. Refrain from initiating physical contact unless you are certain it is welcome. If you have a prior relationship with them outside of a professional setting, you may offer a hug, but wait for their consent before initiating. Be knowledgeable about the next steps in your specific geographic area and the available resources, and supply physical copies of resources. Here are some examples of details that may vary depending on your location. Where can they obtain a sexual assault examination kit? Who conducts the examination in your area? A specialized SANE nurse or an ER doctor? Are the kits provided by the police, or are they kept in the hospital? If they choose to report, what does that process entail with the police? Victims often experience a loss of control. Providing a clear, detailed explanation of the process can help alleviate their feelings of helplessness. Remember, these situations are often chaotic and bewildering for the victim. They may know their perpetrator and can be in a state of shock. Making decisions based on logistics can be difficult, underscoring the importance of comprehensive education beforehand. Take note that minorities and underrepresented individuals, including those with mental or physical disabilities, transgender individuals, and people of color, are often more vulnerable to victimization. It's crucial to examine your biases. Common misconceptions include the beliefs that males aren't victims, females frequently make false claims, and couples, particularly same-sex couples, don't experience sexual assault. The final step in responding to a disclosure is to ensure that you take care of yourself. Exposure to trauma and patients' experiences can have a significant impact on one's mental and emotional health, potentially leading to burnout, compassion fatigue, and secondary trauma. Practicing self-care is essential, which can involve activities such as exercise, maintaining a balanced diet, seeking support from a counselor, enjoying massages, practicing mindfulness, and spending quality time with loved ones.